Hi, I'm Brandis Boyd Cooper with BioMade's Coordination Chronicles, from healthcare from A to Z. Today we have a very special guest. Her name is Tashara Lester, NP, in dermatology, based out of Dallas, Texas. Tashara, can you please tell me a little bit about yourself?
Well, my name is Tashara Lester. I am a nurse practitioner, have been a nurse practitioner since 2019. My first degree is in radiology, so I started out in radiology first, got a bachelor's in radiology, decided I wanted to go back to nursing school, became an RN, became an NP, knew from the beginning of going to school as an NP that I wanted to do derm, and so here I am.
So how did you get your foot in the door when it came to dermatology?
I started in cosmetic first. So I knew that I wanted medical derm to go along with cosmetic derm. And so I went the route of doing cosmetic dermatology first at a place called Laser Way. So that's where I started injecting, doing Botox fillers, lasers, things like that. And then I was able to get the opportunity at my previous job, and I love it.
That's awesome. What advice would you give any other aspiring nurse practitioners wanting to get into the dermatology field?
Do it, do it, especially our brown nurse practitioners. They're very needed. Just we need your expertise in skin of color. So just do it. Get with a mentor, find someone. I don't mind being a mentor to someone, but find someone that you can shadow and study, keep learning, but do it. That's the most important thing. Is like, don't be scared. Have confidence in yourself and just do it.
That's pretty awesome. Talking about skin of color, what are some common skin conditions you see in your practice, especially among darker skin tones?
Eczema a lot. Some people may know it as atopic dermatitis, but eczema is one. I see some psoriasis, a lot of hair loss. In mainly my women, I see a lot of hair loss with just the things that we do to our hair. I see a lot of hidradenitis suppurativa. Some people may know that as HS, but in skin of color, those are the ones that I mainly see a lot of.
Okay, let's go to eczema really fast.
Okay.
What are your go-tos? Like, what kind of treatment methods do you like to talk about with your patients? And what about moisturizations and things of that nature?
First, I like to dig deep into the patient, like what are they using at home? A lot of these patients, they're born with it, so they've had it for so long. So a lot of the times they're on top of their home remedy, home care basically, but they just need that extra from a derm provider. So most of them have already started steroids because a lot of the time the pediatrician or the primary care doctor started steroids. So for me, I really want to get away from steroids on the skin. Mm-hmm. And a lot of these people have dealt with constantly putting something on their skin. So first line, I'm usually going to go to a cream that is a non-steroidal cream. If depends on the patient. It's honestly patient dependent. If they come in and they have a few spots and it's just not going away, then I'm going to stick with cream. But if this patient comes in and they're full-blown eczema, they look like a burn victim, quality of life isn't good, hardly sleeping, the eczema is their life, then I'm going to talk about biologic medication, a more systemic medication, so that my goal is for my patients to walk around and forget that they have whatever skin disease that they have. I want them to, because in the day and time that we're in, you shouldn't have to walk around feeling like you have eczema, looking like you have eczema.
So, question, because I know I've worked with you very closely with getting patients on medications. Mm-hmm. How do you determine between Dupixent, Adbry, Epglycerin, Vogue?
I have my favorite.
It's okay.
I love Rinvoq. I do love Rinvoq, but it's also patient dependent. Everything that I do, I don't have everybody gets the same. I get to know my patients, and I like to find out, are you needle phobic, or are you going to be consistent in taking a pill daily? Mm-hmm. Those are really the things that I look for in determining which treatment plan I go with. So everyone that sits in a chair, they get a different one. It's just all in what works for my patient.
Now, being a dermatology and being a woman of color, mm-hmm. I've have ran across some misconceptions. What are some of the misconceptions you see that need to be addressed with patient care and coming in for skin exams and things of that nature?
We must wear sunscreen. You have to wear sunscreen, no matter. That's the biggest misconception in the brown community, is that we don't need sunscreen. And yes, most of us were raised that we don't need it. And it's not just African American, it's brown people, Hispanics, some of my Asian communities there. They just didn't use sunscreen because we have a natural sunscreen, but we still get skin cancers. A lot of the time, the sun, a lot of the things with us is hyperpigmentation, and we have to remember that the sun just makes it. Yes, it causes it, and it keeps it. And a lot of the times, patients are wanting to get rid of it. Well, you're never going to get rid of it if you're not protecting whatever it is that you're trying to get rid of from the sun. So
I always like to bring up the point of that Bob Marley passed from a skin cancer. Out of everything that could have took Bob Marley out, it was an actual skin
melanoma,
cancer. And so that's why it is also important for patients to remember to wear their sunscreen.
Yes, and it's, skin cancers on us look different. So we still need to get our skin checks. We have moles, again, we get skin cancer, so we need to be getting our annual skin checks just like other ethnicities do.
So talking about patients, because I always hear about your bedside manner. All the patients would brag about it. Of course, you've had a great following of patients that are following you to your new practice. Can you tell me about a memorable moment or something that stands out to you as far as you and your patients' relationships?
I have so many because all of them are near and dear. Because most of the time when patients come to you, especially to a derm provider, they're at their last resort. They tried all these other providers first. So when they get to a dermatology provider, they're just looking for you to listen and do something different than what they've had before. So one that comes to mind is a patient that had eczema or atopic dermatitis, and he looked like a burn victim from head to toe, face discolored. He wasn't sleeping. He had to quit college because he just could not handle the eczema. He was just uncomfortable, just living daily in an eczema world. That's what I call it. And I got him on Dupixent, and the change that he had within 2 months when he came back for his follow-up, he hugged me. We were crying. He said I gave him his life back. And he was able to go back to college. And I actually just saw him last weekend. I didn't know, I went to his place of employment, me and my husband and some friends, and didn't know he worked there. So we're ordering our food, and he brings the food out. And he looked like, wait, I know you, because I look different outside of work. So he brought the food out, and he's like, and I said, I say his name, and I'm hugging him, and I'm like, oh my God, how are you doing? Because I do a 6-month follow-up, so it's been a while since I've seen him now. And he said, look at me, I'm glowing. Oh, wow. I'm great. You helped me. You saved my life. And so that just meant the world to me, for me to see the difference that I made in him. So
that lets you know that you're in the right field.
Oh, every day. Yeah. Every day I am happy to go to work because of the change I get to make for my patients. I'll cry because I just love taking care of my patients. So
that's beautiful.
Yeah.
I'm so glad that I get a chance to work with you and see that side of you as well. You're tearing up. This is beautiful. And see you help so many different patients. And it's patients of all colors. Yes. And they all say the same thing about you. They all talk about how wonderful you are, how great you are, and how you listen. And I feel like that's something that we lack sometimes in dermatology because it's so fast paced. It becomes a numbers game almost.
Right.
And if you have somebody that will actually sit down and listen to you, I think that holds a lot of value.
Oh, yes. Well, I wholeheartedly mean it. When you sit in my chair, you're my family. And I hope that my son, my grandmother, anybody, you're my family. Anybody that gets care, I want to give the care that I want my family to receive. My family gets on my nerves, but I still love them and I still treat them. So it's no different than my patients once you sit in my chair, because most of these diseases are long term. They're lifelong skin diseases that you're not just going to get rid of. So I'm in your life forever. And so the relationship that I gain with my patients is of the utmost importance to me. So.
What have you found the most challenging about being in dermatology?
Skin of color. Not enough research for skin of color. Just some of I'll say skin of color, and then being a nurse practitioner, in the state of Texas, being a nurse practitioner, because we don't get full authority practice. So just those are the things. But I'm with a great provider that I work with now, and so learning a lot with her, able to do a lot more, but the main thing is honestly skin of color, and just more research needs to go into the treatment for skin of color more when we're in school, when doctors are in school, being able to see more representation of skin of color to be treated, and learning different treatment plans.
Yeah, you're one of few, I believe, here in Dallas, even including dermatologists of color. So that's something that I think we do need to put more effort into. I think education.
Education.
A lot of it about education.
Yes, yes.
So do you go to like some of the derm conferences, or is there one or in particular that you're going to, or?
Well, I'm going to yours.
You're going to be on the panel, actually. Yeah, you're going to be on the panel at ACDC.
Yes. Fall clinical. I love fall clinical. There's some specific NP and PAs. SDNP has a great one that I like to go to. There's another one, and it's passing me now.
Is it the diversity one?
Yes, I like that one.
Okay.
There is another one that's just is strictly NPs and PAs, but we have physicians. There's physicians that come on the panel, but it's tailored to nurse practitioners and PAs.
How do you think dermatology can become more inclusive for everyone? Since education is lacking, how can we go out and get students that are in med school and push them? Because they say dermatology is like such a hard field to get into.
Right.
Like, how can we make that awareness?
I think like doing stuff like this podcast, being more open, the people that's in it, being more open, not gatekeeping.
Okay.
Be more open to welcoming other providers into your practice and letting them know your knowledge. I think that's key.
Are you open to having like students follow you?
I have someone right now.
Really?
Oh,
that's
have
pretty
another
cool.
one in the fall that's coming. So yes, I love. At first I didn't, because I was still baby derm, but now I feel like
that you're well seasoned.
Yes, I feel like I'm a little more seasoned, well done, a little bit.
Yeah, I'm thinking about even having my daughter come follow you, just so she could see some of that dermatology aspect.
Yeah.
Since she is one of my coordinators and teaching her, I want her to kind of know as from an MA perspective.
Yeah.
Because sometimes when we get things, she's like, well, why are they missing this? Why are they missing that? And I want her to see what all goes on in a room.
Yeah.
Because sometimes we're getting so much stuff thrown at us, it's easy to forget things.
Yeah. No, I would more than happy.
So can you speak about the importance of representation in healthcare, especially in dermatology, coming from an NP, and how much more work you have to put in because you're a nurse practitioner?
You almost, you feel like you have to prove yourself more. Most patients one of my requirements for wherever I work at is when a patient is scheduled, please make sure you're telling them that they're seeing a nurse practitioner. So most of my patients that come to me, all my patients that come to me came seeking a nurse practitioner. They were fine seeing a nurse practitioner. But representation is important because patients feel comfortable, if they see someone that looks like them. A lot of the time, a lot of my brown patients sought after a brown provider, a brown nurse practitioner, because they feel that we can connect, and I know their hair, I know their skin. I too didn't wear sunscreen at one time.
Right.
So just a comfortability. So having someone that looks like you, it honestly does make a difference, because there's a lot of times that a lot of patients had never seen a derm until they came to me, because they are the one dermatologist that a lot of brown people here, went to.
Booked up. Sold concoctions to. I understand. They were like, "Are you using this?" I'm like, "No."
So,
Should I?
So yes, having representation is very important.
Okay. Can you give me a perfect example of the perfect skincare routine?
Oh yes, no TikTok. So,
did y'all hear that? No TikTok at all.
TikToking. That's why I
Did
tell
y'all
all
delete your app? No, I'm just kidding.
That's what I tell all my teenagers. I'll give them a regimen, and then I say, "Don't TikTok me. Don't start adding stuff in." But honestly, there's so much stuff out. A lot of stuff is fluff. My main things that I tell patients that you need: vitamin C,
Okay.
retinol or retinoid. Prefer retinoid because that's a little bit more potent than a retinol. Hyaluronic acid, and sunscreen.
And sunscreen.
Yes, those are like your main staples of skincare. I use it all day, every day. I was looking at some pictures of mine before I got into derm, and I feel like I look younger now. I think I do. I feel like I look younger now than I did back then, because I was doing all those things. TikTok wasn't out when I was younger, but
We're more on the MySpace era.
MySpace, yeah. So I did all those things. I didn't wear sunscreen. I was splotchy. And so I just feel like, yeah. And honestly, the most important thing is a little goes a long way. You don't have to do all this crazy stuff. You don't need this 10-step regimen. Little ones, 10-year-olds don't need a retinol. So there are certain ages that need certain things. But honestly, just your staples is, again, vitamin C, hyaluronic acid, retinol or retinoid, and sunscreen. A good hydrating cleanser, yeah, in that thing.
A quick question, because somebody was asking me about a product that was used over the counter. Just because it says board certified dermatologist, or is that true? Like for these ingredients, or do they just kind of throw that label on there?
Paper will let you write anything. So a lot of the times, yeah, you can just like
Recommended
organic.
by a
Yes.
board. And that doesn't mean that that's what really happened.
No, not
Okay.
at all.
So we need to run all products by you.
I tell my patients, like, so if someone comes in and they're wanting acne treatments or they're wanting a skincare regimen, we'll kind of go over things, but I make sure that next appointment, they bring sacks in of everything that they're using, because I want to see exactly what they're doing. And a lot of the times they're wasting money. It's like, nope, you don't need that. Nope.
Do y'all sell any products at your office that you recommend?
We do sell products, but I honestly like over-the-counter stuff because I want convenience.
Okay.
The world is convenience, and I want you to stay consistent. Say you run out on the weekend and you bought it from our office. Now you got to wait till we open again. And then that's getting us out of our routine. So I like things that, my favorite is La Roche-Posay. That's my favorite over-the-counter. My absolute favorite.
I'm with you. I've
Yes.
used them a few times.
Yes, that's my favorite one that I go to for a lot of my acne patients, or just skincare regimens altogether. But we sell Skin Better. We sell Revision. We're actually going to come up with our own skincare line here soon.
Okay.
Me and Dr. Waltoff. So that's in the making. But I like over the counter.
Talking about things in the making, what other things do you have possibly going on with your clinic that you might be expounding on?
Oh, we got some new lasers. I personally want to get more into hair.
Okay.
So hair loss, because that's really big in our community. So that's one of my big things, is getting more things in that can help with scarring, alopecia, and things like that. Would love to get into hair transplant if I could.
Ooh, that's interesting.
Yeah. So that speaking with you, at your conference.
Yes, and I want to actually get you in front of some people, because going back to the skin of color thing, I know a lot of the pharma companies are starting to try to do things more around skin of color. Like Johnson & Johnson had something launch, AbbVie had something launch. And just with you being local and being with such a profound, like Dr. Waltoff, I hear so many good things about her as well. I feel like we can do something and have like a conference and invite people, because in us being African American, we are dealing with like the traction alopecia, and there's so many things centered around that. And now that, who was it, Will Smith's wife, when she came out and said that she had alopecia, and then it was like 20 people on my timeline were throwing off their wigs, like, we have it too. So just like having some more awareness around different things like that.
Yes, that you don't have to hide behind your disease. There is other people, going through the same thing, and now there is so much coming out to help with these things. So it's exciting.
So how do you balance your responsibilities with work and well-being? Because I know your husband's also in the medical field. So how do y'all balance all of that?
For one, although I have a patient phone, because I like my patients to get in touch with me, but no one abuses that. But I leave work at work. Outside of my patient phone, because if they need me, I need them, especially if I did a surgery or something, I want them to be able to get me. But I leave work at work, and when I'm home, I'm a mom, I'm a wife, and I enjoy both of those things, but most importantly, I'm me. So I have fun. I go out with my girls. I pour into me because I can't pour into anybody else. My son, my husband, my patients, my practice, can't do any of that if I don't take care of me. I love shopping.
Oh, we could do that together.
Yeah. I love shopping, love getting my nails done. I take care of me. And most importantly, my most important thing I do is I love God, and I allow him to center and guide me on everything that I do. So I pray, talk to him, and I'm good.
I'm glad that you said that, because do you remember the first day you met me? What did we do?
Prayed.
We prayed. And that spoke volume to me, because I was like, I don't even know this woman, but I felt the Holy Spirit coming off of her. I was like, I got to touch you. We got to pray. Like, stop. Let's do it right now.
And we better be obedient,
and
too.
I love that. I love that. And I think that that's why God has continued to bless you as well, you and your business.
Thank you.
How can people get in touch with you? Like, I want everybody to come see you.
Come on.
I mean, you're my dermatologist.
I'm ready.
So.
I am. Well, I am at Intentional Health and Wellness, 6200 LBJ, Suite 110. I have my patient number. I don't know. I can look.
If you want to give your patient number, or if you want to give the office number, it's up to you.
I don't know the office number by heart. I'm going to give my patient number. I know that one by heart. And you all, you can text me if you need an appointment, and then I will send it to the front desk, and they'll get you scheduled. And I'll be more than happy to take care of you. The number is 469-381-4076. Again, 469-381-4076.
And you guys, I'm talking about everything from your skin checks to your cosmetics.
Oh yeah,
she handles it all. She's gonna hook me up next week. I'm due for some Dysport, but she's an amazing individual. Thank you, Tashara, for being here with me and taking time out of your day.
Thank you for having me. You all wear your sunscreen.
Please do.